So welcome. Thank you so much for inviting me to speak today on the topic of food allergy and intolerance in plant-based diets. As you said, my name is Rosie. I'm a plant-based registered dietitian, and I'm delighted to speak to you on this topic tonight. It's a topic that's filled with a lot of myths and misinformation, so hopefully we'll get to dispel some of these today and support you and your patients and clients to have the best and the most robust information that we have on this at the moment. I do think it's important for all healthcare professionals to have a basic understanding of the information provided today, as we're all part of the system that will help us to pick up and diagnose and correctly manage food allergies, intolerances and food aversions as well. So in terms of the learning outcomes, we want you to be able to differentiate between an allergy and an intolerance and understand the symptoms and the diagnostic pathways for each, understand the most common plant-based foods that are associated with allergies and intolerances, and I'd love for you to be able to take away practical information on managing allergies and intolerances whilst maintaining, importantly, a varied plant-based diet for good nutritional health. So I've just put a little overview here so you know what's coming. So I'll go through food allergy and food intolerance separately, talking about the symptoms, who is at risk, and diagnostic techniques as well. And then I'll look at some of the main triggers for allergy and intolerances, which is often a reason why people feel they can't follow a plant-based diet if they've got these allergies and intolerances. And then I'll touch on food labelling, cross-contamination, and also the psychological impact of having a food allergy or intolerance, and then some practical tips at the end. Now, there is a lot to cover in this topic, so I could do a whole presentation on each individual food allergy and intolerance that we'll touch on. So today is really a bit of a whistle-stop tour, and I'll link in resources for you to look at the end as well. So first of all, thinking about allergy or intolerance. So an immediate physiological response to everyday food items such as flatulence or bloating or allergic reactions are actually quite common in our regular life, and I'm sure many of us have experienced some kind of reaction to food in the past. The ingestion of specific food and food products can induce a wide variety of reactions that range from mild to life-threatening. And it's also important to mention that allergic and intolerant reactions vary between individuals, between countries and cultures, and climatic conditions as well. There is a large crossover of symptoms between allergy and intolerance. Dietary avoidance of foods that trigger allergy and sensitivity is the only really prevailing prevention and treatment method, as long as that allergy or intolerance is investigated and confirmed. The poor management of these adverse food reactions can result in inadequate nutrition, poor growth and development of infants and children, increased expense, and potentially anxiety as well, and social isolation. So as health professionals and others who are interested in the topic, a basic understanding of these two very similar but very different reactions is really, really useful. And we can use the umbrella term of food hypersensitivity to describe both of these. So food hypersensitivity, as mentioned, is an umbrella term referring to a reaction caused by a food specific to an individual. And it's thought to affect about 8% of children and 3.7% of adults. As you can see by this flow diagram, it can be categorized into food allergy and food intolerance. So food allergy, the main difference is that food allergy involves the immune system in the reaction, whereas intolerance, otherwise referred to as non-allergic food hypersensitivity, which is a bit more of a mouthful, does not involve the immune system. Food allergy can be further categorized into IgE-mediated food allergy and non-IgE-mediated food allergy, and we'll talk about this a little bit further in the next couple of slides. So talking about allergy to start with, so we'll put intolerance to the side just for a minute. Allergy is an immune system response to a foreign substance that's not typically harmful to humans. It is generally a fault in the adaptive immunity rather than the innate immunity, so the immunity that we learn when we're very young. We refer to these foreign substances as allergens, which you might have heard before, and they can include everyday substances such as foods, pollen, or pet hair, for example. And symptoms really range from mild to life-threatening, and from something like sneezing, rash, to general inflammation, or to anaphylaxis. An anaphylaxis reaction is a serious allergic reaction which happens very, very quickly. Symptoms of anaphylaxis may include difficulty breathing, dizziness, loss of consciousness. Without immediate treatment with an injection of epinephrine or adrenaline and expert care, anaphylaxis can end up being fatal. Allergies are on the rise in the Western population, and the cause of this could be a whole other topic of discussion, but it is thought to be predominantly due to a change in our environment and our lifestyle, or and I think a more westernized dietary pattern is probably part of it as well. Prevalence of allergies ranges from 0.5 to 9%, and there is a big difference between the diagnosed allergies and undiagnosed. We find that there is lots of people who claim to have an allergy who may not be actually diagnosed. So it depends on what sort of data you're looking at there as well. So as mentioned, allergies can be IgE mediated or non-IgE mediated. IgE is stands for immunoglobulin E, and these are antibodies that are produced by the immune system. So your immune system overreacts to an allergen by producing these IgE antibodies, which then travel to cells which release chemicals like histamine and prostaglandins, which cause that allergic reaction. Non-IgE mediated involves other parts of the immune system, such as mast cells and eosinophils, and not IgE antibodies. So I've put a little table here which shows you the difference between some of those reactions. So IgE mediated is a very quick reaction, so it can be 2 minutes or even 30 seconds to 2 hours after you've ingested that allergen. For non-IgE, it's usually a later reaction, so from 2 to 48 hours. For IgE mediated, you can use skin prick tests to understand it a bit further, and I'll go into that a little bit later. For non-IgE, there aren't any tests available. So what we do is we use detailed history and re-challenge frameworks, which again, I'll talk about. IgE mediated can be mild to life-threatening, whereas non-IgE, there's no real life-threatening reaction going on there. So food allergy symptoms, here I've listed the main symptoms between the different allergies. And if you just, I'm not going to go through and read all these out, but if you just scan read between the two, you can see there's a lot of overlap here. So for example, skin rash, nausea and vomiting, and abdominal pain. So who's at risk? So some people are generally more at risk of allergy than others. So these include those with a history of allergy, for example, people who have had eczema, asthma, or hay fever. Or those with a family history of atopy, which is a predisposition to develop specific IgE antibodies. And this is why your clinician will always ask you about your family history when investigating food hypersensitivity, to see if it is in your family. And this will help to build a clinical picture that can then support a diagnosis. So what are the common food allergens? So here is a list from the BDA of the 14 UK recognised common food allergens. And these are the ones that are required to be put on packaging by law. So if you look at any food label in your cupboard right now, then these will be highlighted if they are in the ingredients list. And on these, I have highlighted those that are relevant to a plant-based diet. I won't be covering the animal products involved in allergy and intolerance today, although I might touch on it here and there. The most common plant-based triggers are soy, wheat, tree nuts and peanuts. And we also have mustard, sesame and sulfites in there as well. So it's really important to get a correct diagnosis when an allergy is suspected. I wouldn't advise someone to try and navigate their own allergies, particularly if symptoms have been moderate to severe in the past. We wouldn't advise patients and clients to exclude foods for long periods of time and then try to reintroduce it without guidance. And this is particularly important in babies due to the potential to trigger allergies in babies. I highly recommend seeking the guidance of an allergy specialist or doctor or dietitian, or both, to avoid unnecessary food restrictions and to enable proper testing, diagnosis and management. So let's talk a little bit more about testing. So as I said, for IgE mediated allergy, but not non-IgE, we can use skin prick tests So this is just a tool which means that you can use it alongside dietary and medical history to come to a diagnosis. So the most common is the skin prick test. And I've had one of these done in the past. So it involves putting a drop of liquid on your forearm that contains a substance that you may be allergic to or you're testing your allergy to. And the skin is then gently pricked. And if you're allergic to that substance, you'll find that an itchy sort of red bump will appear after about 15 minutes. And an expert is required to analyse and interpret that skin reaction. So these tests are inexpensive, they're non-invasive, and they provide very quick results with only one attendance to a clinic. And results, they're not 100% reliable, but they are taken in the context of a medical and a food history, and that helps to narrow down conclusions. The test is also safe and it's low risk and performed in a medical environment. And then you have blood samples. So these are indicated if they're indicated if you can't get a skin prick test, or it's not available, or the results are questioned perhaps. So these are often called immunocap. It was formerly known as the RAST test. The information provided is equivalent to the skin prick test, and it is more expensive, and follow-up visit is needed as well. So it's not generally the first line test. Patch testing is also used for delayed reactions on the skin. However, this isn't generally used in food allergies, but you may have come across this if you've ever had your hair coloured or treated or something. They'll always do a little patch test to check whether you're going to react to those substances. And then food challenges can be used with the support of a dietitian or a trained clinician. Only trace amounts are needed for IgE reactions, but larger amounts are needed for non-IgE reactions. And a hospital setting is used for severe reactions, but it can be done at home for the milder ones. And food challenges are often open, so both clinician and patient know what food is being tested when, but the gold standard for these is a double-blind placebo-controlled food challenge, and that's often used in research. You'll see if you're looking at research, and this is when neither the clinician or the client knows which food is being trialled when, but it's often not kind of practical in everyday practice. So you may have heard of immunotherapy as a treatment for allergy. And this is when a re-education of the immune system is used to promote desensitization. And this technique promotes tolerance to a food through the administration of daily oral doses, which are in increasing amounts until a maintenance amount has been established. It has been successfully used to treat some common food allergies, but we can't yet recommend this in routine practice. But do watch this space, but I would advise not to try this at home. So I thought it was important to address the impact of a plant-based diet on allergy today as well, as many of you might be wondering whether a plant-based diet can reduce the risk of developing allergy. We know that diet plays a role by changing the health of the gut bacterial community and certain related immune system activities. Increased fibre intake, which is part and parcel of a whole foods plant-based diet, may be linked to improving the gut lining and reducing the risk of reaction. And this seems to make sense as the increasing processed nature of a Western diet in combination with influences on the gut microbiome may be contributing to the rising prevalence of allergic disease, including food allergy. We also know that plant-based diets rule out some, but not all, of the common allergens, for example, dairy, eggs, and fish. However, studies haven't been done on the impact of diet on already developed allergies, so we just don't know yet. So there is speculation at the moment that a plant-based diet is beneficial in the world of allergy and intolerance, but I'm sure we'll find out more as the research on plant-based diets come in. And I just added this quote in as well from the Centre of Nutrition Studies, who said that allergic diseases are characterised by inflammation. Antioxidants combat inflammation. Whilst the volume of studies might be small, the growing evidence points to a diet high in antioxidants, so things like fruits, nuts, beans, vegetables, as being helpful in reducing symptoms of allergic disease, of rhinitis, asthma and eczema. So again, watch this space. So moving on to food intolerance then, which is a more common food hypersensitivity. Food intolerance is thought to, sorry, my screen's just gone a bit wrong there. So food intolerance is thought to affect 20% of the world population, possibly have a reaction, a food intolerance to a food item. And this is also on the rise as well, much like allergies. Food intolerance, as we mentioned previously, does not involve the immune system, and reactions of this sort are rarely life-threatening, but they can have a significant impact on quality of life. And I don't think we should underestimate that impact as well. Reactions can vary in severity, and they can be immediate or delayed following the ingestion of a food substance. So common food intolerance symptoms can be, again, very varied, as we've touched on. So it can be abdominal pain, wind, bloating, bowel changes, skin rashes, itching, and plus many more. And types of intolerances, there are a few categories of intolerances, meaning they can be caused by a few different factors, and some of these also overlap. So they could be enzymatic, which means you may have a lack of a specific enzyme used to break down the food. So a non-plant-based example would be dairy, due to the natural reduction of lactase after weaning, and this is known as lactose intolerance. Another example more relevant for vegans is something like the inability to break down galacto-oligosaccharides in beans, which can be identified through the low FODMAP diet, which I'll talk a little bit about later on. They could also be reactions to substances in food, such as histamines, if we have difficulty breaking histamines down, caffeine, theobromine in chocolate, benzoates or alcohol. And they could be related to difficulty in digesting food items or food items making existing conditions worse, particularly in something like IBS. So common triggers, I've just made a list here of those that are fairly common. So gluten and wheat, caffeine, salicylates, amines, FODMAPs, sulfites, and also aspartame, MSG, food colorings, and yeast. And again, I haven't included the animal products in this. So how to manage a suspected food intolerance? So if you have a patient, or if you are a patient who suspects a food intolerance, what should you do? As a healthcare professional, it really will depend on your role, but it's important to make sure that that patient or that client is seeing the right person. So first of all, could it be an allergy? It's important to establish anything that may become life-threatening, as this needs proper management, for example, an EpiPen and a management plan. How quick are the reactions after ingestion of the food? What are the symptoms? Do they involve swelling or immediate rash, or are they gastrointestinal? What is the family history? Is there a high level of allergy in the family, or perhaps bowel cancer or celiac disease, which might mean that something else, it could be something else. And based on the answers, you'll need to refer on to someone who can investigate this further. So a doctor or a GP will be a first port of call, who then may refer on to an allergy specialist, doctor or dietitian, based on the findings. A dietitian will use things like food and symptom diaries and food elimination and reintroduction. And tests the GP might do or might consider include things like testing for celiac disease, allergy testing, as I mentioned, things like fecal calprotectin or fecal elastase to look for anything else that might be going on. And once the cause is established, then we can make safe and appropriate dietary recommendations. One example of this is, say, if gluten needs to be in the diet for a reliable celiac screen. So we don't want to take it out before we're going to test for it. We don't want to mask any conditions using dietary changes. And in the same way, IBS should be diagnosed so that we've ruled out things like IBD, bowel cancer, celiac disease, etc. So intolerance testing. So there's no way to test an intolerance specifically. It is a case of using medical and dietary history alongside adaptations of the food and using things like a food and symptom diary to help establish that trigger food. However, intolerance testing is big business, and there are many testing companies out there selling food intolerance tests for a fair amount of money, and they have extremely convincing websites and adverts. And I think if I wasn't a dietitian or a nutritionist, I'd probably be getting my blood tested, you know. So it's really important to be aware that many of these do not have the scientific backing behind them. The British Dietetic Association suggests avoiding IgG blood tests, which are quite big. I think they're often called the York test as well. And we know that the only reliable blood test is an IgE test for allergy. Also avoiding kinesiology, which is muscle testing, hair analysis tests, cytotoxic tests, pulse tests, electrodermal or Vega tests. These tests should all be avoided. They have no scientific basis, and they can be harmful and if foods are excluded unnecessarily. And they do cost a lot of unnecessary expense as well, unfortunately. So yeah, if they told us a really good information, then we would be using them within our clinics, but we don't. I know that myself and Rohini have both had clients who have undergone these types of tests and got rid of loads of different foods in their diet, which has actually turned out to be really detrimental to their overall health. So dietary management of food hypersensitivity. So we'll go through some of the foods that could be a cause of this. So restricting specific foods can be complex. Unexpected ingredients are often present in a wide variety of manufactured foods or used on the same production line and cause cross-contamination. Restriction of food choices can increase the risk of overall dietary imbalance, especially if the problem food is a major contributor to nutrient intake. Help is needed to determine the level of avoidance that is required and develop an individualized meal plan and advice on a whole range of lifestyle issues. So we need to talk to people about shopping, eating at school or in the workplace, social events and holidays, or even intimate issues like kissing. So some types of food hypersensitivity will resolve over time. So regular reviews are important so that restrictions are not imposed for longer than necessary. So managing food restrictions, so we want to make sure that any food that's cut out of the diet is being adequately replaced. So common plant-based trigger foods, as I said, things like wheat, gluten, soya, peanuts, tree nuts, as well as mustard, celery, and sesame. And some of these are going to be a more substantial part of the diet than others. So something like celery might be easier to avoid, as long as you're checking ingredients and things, and easier to replace than something like gluten might be, which means you might actually be reducing your intake of carbohydrates in that case. So now I'm going to go into a few of our top trigger foods that are commonly incorporated into plant-based living. And just to mention this diagram as well, this is the Eat Well guide that you might be very familiar with. This is actually the vegan version of the Eat Well guide from Vegan Society. So it's kind of a nice tool to be able to see what someone's avoiding and other foods within that group that they can replace it with. So starting off with gluten then, there are many reasons why people might be avoiding or reducing gluten in their diet. The first obvious one is celiac disease. So gluten needs to be removed strictly and for the person's whole life. We need to avoid even trace amounts due to the damage that's done to the gut on eating those. And it's not just the obvious bread, pastries, cakes, pizza, pasta, but many processed food products such as vegan cheese, meat alternatives, sauces, salad dressings, and soup mixes contain thickeners and fillers from gluten derivatives. If a product is labelled gluten-free, the gluten content of the final product should not exceed 20 parts per million. However, there are super sensitive celiacs, like me, unfortunately, who may still react to this. So we need, those people will need further advice from a dietitian. And some celiacs can have cross reactions with the protein avenin in oats, for example, as well. So that needs to be assessed and looked at by someone who's qualified to do so. Oops. So wheat allergy is another one that affects approximately 0.3 to 3.4% of the population, but there are difficulties in measuring, so prevalence is not really known very, very accurately. The extent of avoidance depends on the severity of the reaction. So most allergic reactions are inflammation of the skin, the lips, the throat, digestive problems, nasal problems, and severe wheat-dependent exercise-induced anaphylaxis as well is something. And this occurs immediately after the consumption of wheat or its products and depends on the time duration of the exercise after wheat ingestion, which is usually 10 to 60 minutes. There's also non-celiac gluten sensitivity, which is poorly understood, but it is thought to affect between 0.5 to 13% of the population. So that's quite a wide range. But based on symptoms, small amounts could be managed. And then we've also got fructan intolerance, which is a functional disorder. And we would encourage small amounts to still be included in the diet based on the tolerance level. And it's really important to seek expert advice to establish if gluten is a cause of the symptoms. We want to provide advice on the extent of restriction and to ensure that gluten products are adequately replaced to maintain nutritional balance, as we talked about. So in celiac disease and wheat allergy, it's the protein in wheat that triggers the reaction, but a wheat grain doesn't just contain protein. Fructans are the short chain carbohydrates part of the grain, and intolerance is identified through the low FODMAP pathway after ruling out celiac disease. Patients or clients may also be sensitive to other FODMAPs as well. So a dietitian can assess the suitability of a low FODMAP diet as well as help guide a patient through that journey. So this is just a little overview of FODMAPs. It's an acronym that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. They're short-chain carbohydrates that can resist digestion for a number of different reasons and therefore move into the large bowel, where they can influence the delivery of fluid into the large bowel. And these substances get broken down by the bacteria, causing bloating and gas and abdominal pain in many cases. It's not appropriate for all people with IBS, so this should be assessed by a dietitian. And I just want to say a little note to GPs and doctors who might be watching. So please don't advise a low FODMAP diet without making a referral to a dietitian or somewhere where you can get support with it. Because I've come across so many people who are utterly confused about FODMAPs and they don't follow the diet correctly. They end up doing more damage by cutting them out long term, with the potential to detrimentally impact the number and diversity of the gut bacteria. It can also be associated with eating disorders as well. So it's a very restrictive diet. It's a short-term diet, but it is very restrictive. So it's not suitable for everyone with IBS. It is a short-term diet that follows a very specific protocol. So taking this into the context of moving forward with the plant-based diet, eating more whole foods can often mean that you are eating more high FODMAP foods. So often people will say they can't tolerate a vegan diet because of their sensitivity to eating more plants. So it could be something like onions, garlic, and a big one is beans as well. So in this case, if you come across someone who's saying this, I would really encourage you to refer them to a plant-based dietitian for support, because these issues can be overcome. So let's say you have someone who's either been diagnosed with a wheat or a gluten allergy or intolerance, or someone who's just determined to avoid it in their diet. And there's lots of people who want to avoid it in their diet. So what can we do to ensure nutritional adequacy? There are a range of alternatives that provide a really good range of alternative nutrients. Gluten is mostly found in the whole grain carbohydrate section of that Eat Well guide that I showed you. So we want to ensure that this is not eliminated without being replaced. Otherwise, you're risking having a low carbohydrate diet. So these items here are suitable for people with celiac disease, wheat allergy, and also those on a low FODMAP diet. Beware of advising free-from foods from the big, lovely free-from aisle in the supermarket, because there's loads of good-looking treats there, but they are expensive and they are very processed, and they have things like added salt and sugar and fat to improve the taste without the gluten. So whole foods are always going to be best to promote overall health. So moving on to soya. Soya is a controversial little bean, but I don't think the controversy is deserved. Soya is very beneficial to health. It's high in fiber, high in protein, low in fat, and it's linked to lots of reduced risk of lots of diseases. So it's an excellent thing to include in the diet if you're plant-based or not. And soya allergy actually impacts only 0.3% of the population in Europe. So it's very uncommon compared to something like a milk allergy. But if you have an allergy or an intolerance to soya, then you need to be aware of all the places that it can pop up. So soybeans, soya flour, soya oil, edamame, tofu tempeh, soy milk, soy yogurt, soy ice cream, and actually 60% of processed foods use soy as an ingredient. The common symptoms include skin problems, digestive problems, respiratory problems, and rarely anaphylaxis as well. Soya can be used as a food texturizer, emulsifier, or protein filler. and soya flour is really widely used in foods including bread and cakes and processed foods and baby foods as well. Soya sauce contains very little of the actual soya bean, so most of the protein in there is from wheat. Soya lecithin is a fat, so many people will be able to tolerate it still. Soya oil is mostly tolerated because the protein has been mostly removed, and that's with the exception of those cold-pressed posh oils from a delicatessen. So soya is classed as a major food allergen, and therefore it should be really clearly labelled on products. So if you're going for more whole foods, then it will be easier for you to know what is going into your food, and you don't have to read labels quite so much. And I would advise, if you want more information on this, Allergy UK have an extensive fact sheet of all the ingredients that denote the presence of soya on a food label. So that can be really helpful if this is something that you are struggling with. The diagram here in the top right denotes the other foods that may cause cross-reactivity. So peanuts, pea, birch pollen, and tree nut. So cross-reactivity occurs when proteins in one food or substance share characteristics with those in another food or substance. And a person who is allergic to one may therefore have a positive allergy test to the others with the similar proteins. So replacing soy on a plant-based diet. So if soya is being avoided, it is important that it's replaced with foods that provide all the nutrition that may be lost when you're removing soy. So lots of people are concerned about this, particularly if they are on a 100% plant-based diet, as they may rely on soy for things like milk, tofu and tempeh and those sorts of things. As mentioned, it is beneficial, but it's not essential. So if you are avoiding soy, go for alternatives like fortified pea or oat milks. Choose high protein plants with meals such as beans, lentils, nuts, seeds, and this will also provide things like iron and fibre. And go for whole grains, so particularly high protein grains such as quinoa and buckwheat. And really importantly, just keep the rest of your diet really varied. So choose lots of colourful vegetables, including dark leafy greens as well. So at Plant-Based Health Professionals UK, we do have a fact sheet by the lovely Rohini on replacing soy in your diet. So this can be used for yourselves and all your clients, and it is free to download as well. So moving on to peanuts then. So peanut allergy is thought to affect about 2% of UK children, and this has been increasing in recent decades. Peanuts are a legume, so they are actually a different family to tree nuts, and this family includes peas, lentils and chickpeas. And those with a peanut allergy may also be allergic to lupin and sesame, but I would encourage you to seek some specialist advice on that. The associated allergic symptoms include inflammation, itching feeling in the mouth and the throat region, tongue tingling. It could be anaphylaxis, anaphylactic shock, breathing trouble, and low blood pressure is also noted. So this allergy usually develops in early childhood and can occasionally appear later in life as well. And it tends to be persistent. So only about 1 in 5 children outgrow their allergy. Infants with eczema or egg allergy are more at risk of having a peanut allergy, and early introduction is thought to reduce risk, but I would highly recommend seeking specialist advice from a specialist paediatric dietitian for support with this. So the flour obtained from peanuts is rich in protein and contains less carbohydrate, which is generally used in the production of things like snack items, chocolate bars, baked items, and other food products. And with a diagnosed peanut allergy, it's really important to understand where peanuts are found in foods and read labels really carefully, as peanuts, they're not a major food group, so they can be replaced in a balanced diet with alternatives like nuts and nut butter and seeds, ones that are okay, and things like beans, tahini and hummus as well. So the diagram on this picture denotes that the potential cross-reactivity with peanuts are soy, lupin, tree nuts and pea. So touching on tree nuts then, so tree nuts are basically edible seeds, and tree nut allergy tends to affect around 1.76% in the UK. Being allergic to specific nuts does not mean that you're allergic to all nuts. However, with an existing peanut allergy, you do have an increased likelihood of being allergic to developing a tree nut allergy of about 30 to 40%, as there's similar proteins found in both nuts. And again, Allergy UK has a list of all the ingredients linked to tree nut presence in their fact sheets as well. The cross-reactivity of tree nuts with birch pollen often results in the occurrence of mild symptoms around the mouth region, and it's termed oral or pollen food allergy syndrome. Other cross-reacting foods are peanuts and soy. So replacing nuts on a plant-based diet. Nuts are a really healthy addition to any diet. They provide fiber, protein, unsaturated fats, vitamins and minerals. They're particularly useful in plant-based diets as a snack, using for cashew cream if you've got creative with your plant-based cooking, nut milks, and to add calories if someone is trying to get more energy in as well. But if you have a nut allergy, avoiding them is really crucial. There's no reason to avoid a plant-based diet due to a nut allergy, so they can be replaced. So if you or your patient or client is avoiding tree nuts due to an allergy, then you can replace these foods high in protein, fiber, good fats, and other micronutrients such as seeds and their butter, chickpeas, beans, oats, and avocados, which I've added to this slide here. So we don't have time, unfortunately, today to cover all substances causing allergy and intolerance. And actually, any food substance could be indicated in an allergy or intolerance. But here is a list of some of the other common ones to be aware of. So as I've mentioned, we've got sesame, lupin, celery, and mustard, which are all part of those 14 allergens that are labelled clearly based on legislation. You've got pollen food syndrome or food pollen syndrome, oral allergy syndrome, which is the swelling of the oral area, which is linked to hay fever. Triggers are fruits and vegetables mostly, so things like apples, peaches, grapes, asparagus and bell peppers. And then you've got pharmacological substances, so biologically active amines. So these end up in things like tomatoes, pineapple, citrus fruit, licorice and spices, and they're mentioned to naturally possess the histamine releasing capacity. Salicylates, theobromine in chocolate and alcohol as well. And then you've got food additives as well. So about 0.1 to 0.4% of the population react to food additives. So these can be things like colours, benzoates, sulfites, MSG and artificial sweeteners. So just mentioning food labelling then, it's really important for those who require to avoid certain substances to make sure they're familiar with reading food labels. I think it's useful to be aware that there are those precautionary statements, so things like may contain or made in a factory containing statements. And it's important to remember these are voluntary, so they're not governed by law. So I would advise that it's really depending on your severity of your reaction, then if in doubt, leave it out, I would say. Sometimes contacting the manufacturer can be useful, for example, finding out if lecithin is soy or egg derived, and be aware that manufacturers and companies can change their ingredients lists quite regularly, so do keep an eye on those. Cross-contamination, this is important as well. So this occurs when allergen-free food comes into contact with allergens. And this could happen at any time. So for example, during manufacture, storage or preparation. Steps to reduce cross-contamination are important. So for example, wash your equipment between using them, use different toasters and spreads, avoid buffet style dining where utensils can be dipped in different food items, ensure your household, so maybe your family or your flatmates are aware of the risks, and also when you go out, when we can go out, then fully inform chefs at restaurants as well. And I've added some practical tips here for eating out and traveling, which hopefully will be able to become more relevant in our lives in the coming weeks. So, you know, things like being involved in choosing the restaurant, looking at menus online, phoning ahead, being open to bring things to friends' houses, being really prepared. I would say to research to find suitable outlets on your route or wherever your journey is, and using a translation card as well. So if you're going abroad, you can get a translation card. So that means that you can show people in restaurants or chefs or anything in their own language what you need to avoid. So the last thing I want to talk about is anxiety. So working as a dietitian or a nutritionist really highlights the link between food choices and psychological health. So it's really important to consider that having an allergy or an intolerance can be really stressful and isolating for patients and clients as well. People may also suffer from food aversions, and this is when a food is avoided for psychological reasons and not necessarily physiological reasons. It's important to remember that avoiding food can be really time consuming and expensive, and living with symptoms can lead to low mood or even worsened symptoms, particularly in the case of irritable bowel syndrome. So ensure specialist help is available for physiological and psychological symptoms as needed by that patient or client. And patient organisations like Allergy UK and Celiac UK are really useful for advice and sort of patient support groups for those living with or concerned about allergy. So in summary then, allergy and intolerance can have really similar symptoms, but they do have very different biological pathways. IgE-mediated allergy can be tested for using skin prick tests. The most common plant-based triggers are gluten, soy, peanuts, and tree nuts. However, there are many other substances that could be involved. Referral onto a specialist healthcare professional is important for the investigation. And despite eliminating certain foods from the diet, then it's still really important to follow a balanced diet that compensates for that nutritional profile of the avoided foods. And I think also just don't underestimate the impact on quality of life and anxiety that living with a food hypersensitivity can cause. So I've added some resources here. So there's a really good webinar on food allergy, specifically NHS. There are the Allergy UK fact sheets. You've got Plant-Based Health Professionals UK, which are putting on this webinar, and they've got fact sheets on IBS, soya allergy, celiac disease, and also introducing peanuts to your baby. And then you've also got the British Dietetic Association, which isn't specifically plant-based, but it does have lots of information for you or your clients and patients who can take away sort of simple information. So I've had to cover quite a few areas, so I haven't been able to go into huge detail with anything. So if there's something that you want to find out more about, then those are always good places to go and have a look. My references are here, and that concludes my presentation. So thank you very much for having me, and I've put my contact details there if you want to get in touch.
That was absolutely incredible, Rosie. I learned so much, and I loved your slides were so beautiful. I couldn't take my eyes off them. Really, really nice. Thank you. We already have so many questions, but before we kick off, I would just love to ask you how you got interested in plant-based nutrition, and a little bit about your journey as well.
Yeah, sure. So it was a bit of a roundabout way of coming around it, really, because as you mentioned, I used to be a zoologist, so I used to work in animal behaviour. So a lot of the research I did was very much based on kind of farm animals and sort of how they're sort of treated and things. So I think that kind of opened my eyes from a sort of animal welfare point of view. And at the time, obviously, I was working as a zoologist. But then when I went vegan, I actually found that my health, you know, I wasn't unhealthy, I wasn't, you know, in bad health, but I actually found that I felt much better, and my digestion was better, and everything seemed to improve. And having had celiac disease all my life, I already had a bit of an interest in nutrition and how, you know, what you eat affects your body. So I think I was just, after all that, I was just really driven to find out more and go and get myself qualified and start working in this area, because it was, yeah, really exciting to find that how brilliant things were. So I came from the animal welfare side, but, you know, I think that this is just the health side of it really got me interested.
That's wonderful. And I've read some of your great articles, you know, on the Vegan Society's website, and of course you're a, you know, an advisory board member for Plant-Based Health Professionals UK. You have talked a lot about, you know, living with celiac disease and also being vegan. And could you share a bit more about your experience with that, and when you found out that you had that and how you manage it?
Yeah, sure. So I was actually diagnosed with celiac disease when I was 9 months old. So that's quite an unusual thing, I think. But I was a sort of failure to thrive baby. I was very sick. And so they did the relevant tests and biopsies and found that I was celiac. So so then just going to a plant-based diet means I became a thriving baby, which I think my mum was, yeah, obviously very pleased about. So I've lived with celiac for a very long time. So I think in some ways it does make it a little bit easier when you're not having to make those huge changes. You know, I never got used to having normal bread and cakes and those sorts of things. And I think as a child, I always felt a little bit, you know, different. No one back then knew what celiac disease was or what gluten was. So I did feel a bit isolated in that way. But I think it probably gave me the confidence when I came to a vegan diet to, you know, feel confident in restaurants asking for different things things, or you know, I've already had a different diet, so I just had to, you know, add a few more things to the list of things that I wasn't having. And I think, you know, it can be quite daunting if you are just becoming vegan as a celiac, or perhaps you're a vegan who's just been diagnosed with celiac. I think it can be very overwhelming. But once you've kind of found those swaps, you found those things that you like and the things that work for you, and you get confident with talking to people about it, or, you know, if you're going out for dinner, talking to people about it, talking to restaurants about it, then it starts to become second nature. And I think that once you find that your health is improving so much, then it becomes much easier to have that confidence and feel good doing it.
That's so wonderful to hear, thank you. So one of the questions that's come up a few times is, why does it seem to be that allergies and intolerances seem to be more prevalent as one gets older, or is that a myth? Specifically, the question is, what's the connection between developing food allergies later in life and changes in the pH of our gastric acid? And is SIBO connected to developing allergies?
I think, so that's quite a big question. I think that there's lots you could talk about in there. So I think that, you know, as I talked about, the integrity of our gut lining it could be indicated in development of allergies, because if that gut lining is letting bacteria or any kind of foreign food substances through, then you're perhaps more likely to have a reaction to those things. So actually keeping your gut really healthy, and SIBO, I haven't got the research in front of me, but potentially I suspect that might have an indication in it. In terms of, you mentioned getting older and having food allergies. So a lot of allergies do start in childhood, but actually for something like celiac disease, that actually you've already got the predisposition to it, and it takes a turning on of that gene, and that can happen at any stage in life. So I think that those sorts of things could be indicated in actually developing something, you know, later on in life. I don't know if you've got anything to add to that, Rohini, because I know you've got some knowledge on this area as well.
A lot, not more than you, but I know that we are going to keep covering allergies and food intolerances. I know that there are some questions, relevant for a pediatric dietitian as well in the Q&A box, but we will have one of our pediatric dietitians come on and talk as well, because
I think that'd be great.
That's such a specific area, isn't it?
Totally. So I'm not a pediatric dietitian. I think that if anyone's got questions on sort of children and babies, then definitely going to a specialist on that subject is going to be the best thing to do.
Yeah, that's going to be really important. So we have a question from a GP, which is really great, about what you would ask patients to actually write in a food diary when they're specifically looking for allergies and intolerances. Is there a template? I think, with allergies, sometimes it's easier, but the food diary with intolerance is, you mentioned that can be a good place to start. Do you have any ideas that you recommend for GPs and other
Absolutely. Yeah, so it can actually, so there are templates. So if you were to go somewhere like Allergy UK or something like that, they do have templates available. But actually, what I tend to do is, if patients or clients want to just, it is actually a very simple kind of structure. It's literally what you're writing. I would say to try and be as detailed as possible. So any little bits that you're adding to the foods, what type of food you're having in one column, so types of foods in one column, and then another column with your symptoms. And that would be it really. That's something that I get people to do quite a lot. And then it really helps them to understand what's going on as well. And it's important to remember also that it's not always going to be immediate. So it won't be, you've had that food and then next to it in the column, you're going to have the reaction that you had. It might be the next day, because if it's a more lower gastrointestinal issue, then it might be the next day. But having that food and symptom diary, I think, if GPs would start to use those with patients, I think that would be really good. I think it would help patients to really start to understand what they're eating and how that's affecting them. I think that kind of structure really helps that patient or client to just understand in black and white. I mean, there's been research to show that when we think back over, what's happened in the last few days, we're not very good at writing things very accurately. So actually having it in black and white can just make it so much easier for people to understand what's going on. A really simple structure is fine.
Yeah, that makes total sense. That was Allergy UK that you mentioned for that.
It was, yeah.
Wonderful. So, you know, there's a few other questions relating to, you know, a diagnosis and kind of testing, and you covered that in the talk. But one of the things that I've seen constantly on Instagram and Facebook is these ads that get bombarded to people around things like hair, you know, hair tests where you can get a strand of your hair and then they can test that for food intolerances. There's patch tests, IgG tests, various things in private clinics all over, and sometimes you'll send them off to the lab. I see those all over social media in particular. Do you have any thoughts on that? Because I know people do turn to those when they're pretty desperate because they've tried, they've gone to the GP maybe and they've had a result and then they've been told there is no allergy, but then they go down these other routes. Do you have any thoughts on that?
Yeah, definitely. And I see it as well myself. So when I'm, you know, obviously I've got a lot of food things on my computer, so I do get bombarded with these adverts as well. And it's really sad to see, because I think if you are in a position where, you know, you're really struggling and you're kind of desperate to find out what is going on, then those look so appealing, because it's literally, you know, you put something in the post or you send off something and then you get told what intolerances you have. But it's really disheartening, because, you know, you see celebrities endorsing it and everything, and it is disheartening, because, you know, if those types of things were accurate, then, you know, we'd be using them in clinic, but we're not, because we know that they don't tell us at the moment. We don't have the evidence to say that those tests will give you an accurate, you know, a list of foods that you need to avoid. And like I mentioned, I know we've both seen people in our clinics who have previously done a test and have got a list of things that they're trying to avoid in their diet, which is detrimental to things like, you know, trying to find alternatives, their stress levels, and also if they're restricting, they can really, you know, drop a lot of weight. And I've seen people in actually in hospital who have their BMI has been tiny, because they've actually been thinking about one lady in particular that I saw that saw someone who diagnosed all these allergies to things like egg and milk and sesame and soya. And, you know, you'd struggle to feed anyone who's getting rid of all of those things out of their diet, and then that can be really detrimental to health and just make things worse. So yeah, it's really frustrating, and I'm hoping that there'll be some kind of legislation around those in the future.
Yeah, that's heartbreaking. And as you mentioned throughout the session, is that there are so many options. When we look at kind of whole plant foods, there are so many naturally sort of, even say if you have celiac disease, you've not found any shortage in sort of the number of different grains that are out there. There are so many different grains and things that, you know, can be explored with some guidance. Certainly, you know, seeing a registered plant-based dietitian such as yourself would be ideal to get that input, so that you know, it can seem a bit like a very frightening prospect to get diagnosed with a food intolerance and then have a big part of your diet removed. But for people who want to be vegan for ethical or environmental reasons, or plant-based health, if they have got an allergy or intolerance, would you say that that's something that they could work on with like the help of a registered dietitian? Is that what you would suggest for someone in that position?
Yeah, definitely. I think that that's something that we can definitely advise on and support people to get that real range of foods. You know, you're mentioning you know, the fact that I was moving from and I've not found a shortage of foods. I actually think that my diet diversified when I went plant-based, because, you know, I discovered all these things that I'd never had before, and I discovered recipes that I loved of different plants. And I think now I get loads of different plants in my diet, whereas before I might have just, you know, gone for the gluten-free version of something and cooked that with, you know, just a kind of in a standard Western kind of way. But I think going to a whole food plant-based diet means that the options just hugely expand, and so you've got more to choose from. So if one's missing, you've got a whole range of other plant foods. You know, in the Western world, we eat such so few varieties of plants, you know, wheat and you know, corn. You know, these are things that we kind of stick to, but there is so much more out there, and we know that a variety of plants is really good for us in terms of our gut health, and that then, you know, extrapolates to the rest of our health as well.
Completely. And as you've said, there is, you know, if you are listening and you are on a plant-based diet, then do get the right advice, because it can be really easy to read one source that says cut out nightshades or cut out gluten, but actually, you know, keeping in, unless we have a diagnosis, it's important to not restrict our diet too much. As you've said, you want to really incorporate that wide variety of plant foods.
Absolutely. Yeah.
So I love that you emphasize that, because I think that there are a lot of confusing messages. And again, yes, all those all those adverts don't help. They definitely are not getting the right customers if they're both they're targeting us
Yeah.
on our feed.
Absolutely. Yeah.
Yeah, so you know, one of the things that I'd love to wrap up by asking is, how can people stay in touch with you in terms of, do you see clients? How can people follow your work and stay abreast?
Yeah, sure.
Yeah,
So I put on the slides my contact details. So I'm on Instagram as Plant Dietitian Rosie. So I do stuff, you know, that I'm cooking and kind of just everyday stuff on there. And then I've also, my email address is rosie@rosemarienutrition.co.uk. And I am just starting to take on private clients as well. So if anyone's got any inquiries about that, then do, yeah, feel free to get in touch. And the website will be up and running soon.